What's your name, please?
Yes, my name is Ondine Sherwood.
Ms. Sherwood, you are one of the founding members of a group called Long COVID SOS.
Yes, I'm a founding member of Long COVID SOS. I'm here actually representing two other groups, Long COVID Kids and Long COVID Support, and we'd all like to offer our sincerest condolences to the bereaved families.
Thank you. As you say, I'll come to the other two groups in a moment, but on behalf of Long COVID SOS, you have provided the inquiry with a statement.
I have.
I see it's helpfully on screen. At the end of that statement, I don't ask for us to go there, but you have signed the statement stating that you believe the contents of it are true with the date of the 25th of September 2023.
Yes.
As you've indicated, Long COVID SOS is the group that you are here to represent. It's the group that you helped to found. But there are two other Long COVID support groups that have core participant representation before the inquiry.
Yes.
And witness statements have been filed on behalf of those two groups as well. Mm-hmm. Perhaps if we can just call them up briefly. The first is a statement from Natalie Rogers on behalf of an organisation called Long COVID Support. And I imagine you're familiar with that statement.
I am, yes.
Right. And secondly, there's a statement from Sammy McFarland on behalf of Long COVID Kids. Mm-hmm. And those are they not other three groups that are represented for the inquiry
Yes.
on behalf of Long COVID. And no doubt there are many other support groups relating to Long COVID throughout the country.
Yes, there will be.
Let's focus, for the moment at least, Ms. Sherwood, on your organisation,
Okay.
Long COVID SOS. And if we look at page 2 of your statement and paragraph 3, we see you say there that the group was established in June 2020. Mm-hmm. That date, of course, fits very much with the chronology we were just discussing with Professor Breitling and Dr. Evans. Mm-hmm. And you say that you helped to found that organisation. I take it there were other people involved at the start as well.
Yes.
And you describe the organisation as a volunteer-run patient advocacy and campaign group. Can you tell us a little bit about how it started?
Yes. Having not recovered from COVID, which I developed at the end of March, I really couldn't understand why I wasn't recovering. It was very odd, and I initially thought it must be something wrong with me. Why on earth was I not able to throw off this virus, which I hadn't had a particularly severe infection. But I came across an article written by a young woman in America in the New York Times where she described ongoing symptoms and that she had set up a support group. So I joined that support group and was quite astonished to see the messages going back and forth in that group. How many people were in there, the ages, the symptoms they were experiencing, and it was shocking. It really was, and it put it all into context for me. I realised I was not alone. And after a few weeks,
sorry, Michelle, just tell us, it was shocking because you realised that other people were suffering the same as you, or because a lot of other people were suffering?
It was shocking, the extent of their suffering. Because remember at the time, COVID was described as a mild illness unless you were very sick in hospital, and that the prime symptoms were fever and a new continuous cough. Yet the range of symptoms that these people were suffering was far wider, and many of the symptoms were frightening and debilitating, and many of the people in that group were very young and had been very fit. And
could you slow down, please?
Oh, sorry, am I talking too fast?
No worries. Sorry, I speak too quickly as well, but...
OK, I will slow down. Yes, that was what was shocking. The symptoms, the people experiencing the symptoms, the number of people all over the world, a lot of them were in America, and the most shocking of all was the fact they weren't getting any help. They were all saying, no one can help me. And that was... It was extraordinary, it really was, and that really motivated me to answer a call from one of my co-founders to march in Parliament, because I felt something had to be done.
So those were the circumstances in which you set up with others
Yes.
this group. Just I want to go back to something you said. You yourself, as you've explained, had continuing symptoms of COVID.
Yes.
And do you, in fact, continue to suffer?
I'm much better, but I think I have a vulnerability in that if I overdo things, I will have what we term a relapse, and I can have a day or few days of feeling unwell. And that will happen if, I've exerted myself too much, or particularly if there's been a lot of stress. So I think that is something residual that I may always have. But fortunately, unlike many, I have managed to get my life back.
Coming back to the group, you were starting to tell us, and it's a core theme of your statement, that the group was formed for the purpose of what we've seen described as patient advocacy. And was that because you and others felt you weren't being properly supported at the time?
Yes, we felt abandoned. The film we made in those early days was called Message in a Bottle. And that was really to illustrate how many people felt that they were really on their own, that they had been abandoned by the government, they weren't getting any health care, doctors didn't understand their condition. In fact, when I was in the acute phase, it struck me that with all the emphasis on hospitalisations and deaths, but nobody was really examining the people in the community. No one was looking at us. No one was researching us, suffering at home.
Just pause there for a moment. If you can try and keep. I'm sorry to.
Slower. Sorry.
I'm sorry to come back to it, but if you can try and keep
Yes.
keep it slower, that would be much appreciated.
Okay.
You were suffering at home, and what you've said picks up another one of the themes of your statement, which is that you and others perhaps were misunderstood. I just want to quote. One of the accounts that you give in your witness statement, not from you, but from one of the people involved in your group, is what was said is, my ongoing symptoms were often met with scepticism and a degree of gaslighting.
Yes.
Was that a common experience?
Very common. It was very common because doctors didn't seem prepared for this, even though post-viral syndromes were known, but they weren't prepared for this. They probably weren't prepared for the extent of it. Some of the symptoms they interpreted as anxiety, and many patients were told they were anxious and sent home, including people whose children were presenting with symptoms, where they were told their children were being influenced by their parents and that these symptoms were fabricated. So there was a huge amount of gaslighting. I'm afraid that was a word that was used a lot in the support group, and people really felt that. And I have to add that it has been said by many people that the trauma of not being believed was one of the worst aspects of their experience.
The steps that you took as an organisation, as you describe in your witness statement, became largely engaging with, attempting to lobby and advocate with the government. And perhaps we can turn to page 6 of your statement, paragraph 23, which starts at the bottom. And you say that while your advocacy initially focused on the need for formal recognition for and treatment of long COVID, you soon discovered that you also had to work hard to put pressure on key decision makers so that important issues such as counting cases of long COVID were addressed. And you refer also to the impact of decisions around easing restrictions, distribution of vaccines, and so on.
Yeah.
And you then list what I think are the sort of key topics or key aims of your advocacy over that period of the pandemic. Campaigning for formal recognition of long COVID, advocacy for the incorporation of long COVID in government decision making, counting long COVID, advocacy for improved treatment and other matters. I want to go, if I may, to a letter that you wrote right at the start of your campaigning. You refer to it, in fact, I think lower down on that page. But if we could call the letter itself up on the screen, please. It's 238582. And so we can see, Ms. Sherwood, it's dated the 3rd of July. So within a month or so of your organisation coming
Yes.
together. And we see that it's addressed to a series of people, the Prime Minister, the Health Secretary, Chris Whitty, Patrick Vallance, and then the Chief Executive of NHS England, and also the health, the Chief Executives of health authorities in the devolved nations, and also the Chief Executive of Public Health England. Could I just ask you about the devolved nations, something that this inquiry takes an interest in? Is your group one that spans all of the UK, or is it an English group?
Our focus has become England mainly because the core members, the core volunteers, all live in England. And we've also, because, as I may tell you later, we work quite closely with NHS England. So that became our focus. The other two groups, who form the long COVID groups, both have organisations or sub-organisations who work with the devolved nations. And so they do more work with Scotland, Wales and Northern Ireland than we do, because we've really worked hard with NHS England, and that's been our focus. But we did write to the devolved health authorities, and we did get replies from two of them.
Yes. Unlike some of the people in this country that you wrote to.
Yes.
Well, we'll come back to that. I don't want to, we won't go line by line through this letter, but I just want to pick up on a few of the points that are made in it. First of all, the first substantive paragraph, you talk about representing thousands of forgotten victims of COVID-19, and you describe them as struggling to get help from the medical community for their continuing disease and feeling abandoned by the government. That's quite a strong term, but was that how you felt at the time?
Yes, I think that encapsulates the feelings of most people who weren't able to get any help. And of course, the thousands was an estimate.
It was, but perhaps I should have asked you this earlier. I was going to. In terms of the reach of your organisation, I think it's right to say it's not a sort of old-fashioned membership organisation where people sort of join and have a membership card. You're largely based on as a sort of social networking site and so on. But you do give some details in your statement about how many people you have following your feeds and so on. And is it right to say that you, as an organisation now anyway, you reach tens of thousands of people?
Oh, definitely, yes. Yes.
And at the start, how many people were involved?
Well, we weren't running a support group. So we didn't have people signing up to a support group. We were running as a campaigning organisation. But our social media accounts grew fairly quickly. And as did the website, attracted quite a lot of people signing up as well. And at the beginning, it was difficult to know how many people we were representing. We knew that, for instance, Long COVID Support had a Facebook group, which at the time I think was, I may be wrong, but I think it was at the beginning, around about this time, it was about 3,000, 5,000 people. So we knew that there were a lot of people involved, but nobody really knew how many.
Yeah. Just going back to the letter, if we can go down a bit further down the page, about halfway down the next paragraph, you refer to the fact that people had been told that they only had mild symptoms, that they were told to go home, they had to struggle on their own, and that there was, as it were, a dissonance between, on the one hand, all the public health messaging saying it's a mild condition, don't worry about it, and on the other hand, these alarming ongoing symptoms that people were suffering.
Yes, certainly. Many people who probably should have been in hospital, but they weren't able to go to hospital because their symptoms weren't considered quite bad enough by 111. But even if they weren't eligible for hospital or they weren't as bad as that, they were quite ill. And this use of the word mild is very misleading, because for most people it wasn't mild.
And I suppose we also have to bear in mind, or remember quite what it was like during 2020, the early months of the pandemic, and a great concern, perhaps, about going to hospitals if one didn't feel one really needed to be there.
Yes, I think there were a lot of people who would rather have stayed out of hospital. But those who should have been admitted were, some of them, their loved ones were asked to keep an eye on them every hour in the night in case something went wrong. So many people had a very traumatic, acute COVID experience.
Yes. Let's look over the page if we can, and the sort of third paragraph down. In the middle of that paragraph, we can see there's a sentence starting unfortunately. You describe people who've been infected with COVID-19 being told, it would seem rather dismissively, that they're just suffering from anxiety and in fact a range of other diagnoses, some sort of post-viral symptom, fatigue. Is what you're trying to capture there, going back to this point about just uncertainty amongst the group as to what it is that's wrong with them?
I think that amongst doctors, and this is kind of speculation, but it's something we've discussed at length, the doctors didn't understand the symptoms, and many don't really like to express to their patients that they don't know and they don't understand, and so they fall back on something they do understand. Well, this could be anxiety, you know, it's an anxious time, we're in a pandemic, and breathlessness, fatigue can be symptoms of anxiety, so let's hope that's what it is. And post-viral fatigue, which was what I was told I had, I don't think it captures the experience that people were having.
Yeah. And if we just look at the next paragraph down, we see essentially the core complaint of the letter, which is, looking at the first sentence, there appears to be very little focus on the part of government on the ongoing very poor health of potentially hundreds of thousands of people. It's imperative that the needs of this group are addressed. And that's what your group was really trying to do at that
Yes.
stage. Bring it to the attention of the government.
Yes, because it seemed almost hard, it was almost impossible to understand how so many people could be so sick and nobody was talking about it. It wasn't present in any conversation. It was only starting to be, it was in certain news articles from maybe May, but very few. And it simply was not mentioned by government or by public health messaging. It just wasn't there.
Yeah. I'm just trying to remind you of. Yes, if we can go back to your witness statement, please. It's the bottom of page 7. It's paragraph 27 at the bottom of that page where you describe the letter we've just been looking at in detail. But if we pick it up at the end of the penultimate line, you say, we did not receive any response from the UK government to that letter.
No, no one from government replied.
I'm not going to call it back up, but you wrote to Prime Minister, to Matt Hancock, to Chris Whitty, to Patrick Vallance.
We had replies from the devolved health authorities. We had a reply eventually from Professor Stephen Powis from NHS England. We had a response from Public Health England suggesting we contact Department of Health and Social Care. And we had, I copied it to all the MPs, so we had responses from some MPs supporting us, mostly opposition MPs, as far as I remember. But no, we didn't get anything back from government.
Now, we've heard from Professor Beitling and Dr. Evans a little bit about what happened later for the second half of that year. And there were various developments, for example, the round-table meetings at the Department for Health and the setting up of the long COVID task force, to name two. And I think it's right to say that your groups or groups like it were involved in those various initiatives.
That's right, yeah, we were.
Were you personally involved in either at the roundtable meetings or
Yes.
in the task force?
Yes, because we worked by the time the task force was set up, we were having regular meetings with NHS England. And in fact, we encouraged them to publicise something, that announcement that they made in October about the 5-point plan, because we were getting so many people saying, what's happening, why aren't we getting any help, what are we going to do? And we were working with NHS England, and we said, well, what are we supposed to say? Is anything happening? So that's why you'll see that there is a quote from our organisation on that press release. And we were part of the task force and invited to sit on the round table.
And in a few sentences, what was your impression of those initiatives? Did you feel that they were effective? Perhaps over time, your view changed on them, but tell us what your views were.
Well, the task force was much more focused on the NHS and on care. And it was obviously very encouraging when that was set up. And it was very good to be in a forum with scientists and doctors and talking about this condition and having the condition taken seriously and discussed in a serious manner. It became obvious after a while that decisions weren't going to be made at that task force. It was a forum for discussion, and that anything that happened would take place in between meetings. The subgroups that were set up, actually also it was our initiative to set up subgroups in the task force. They were very good because we could have much more focused discussions. So after a while, we did begin to wonder, where is it leading us? Because we were still having trouble getting any treatments established for long COVID, and people were complaining about the clinics and so on. So there was some frustration there. As far as the round table goes, that was also a very exciting moment, that we were going to be having meetings with a government minister. And certainly the government ministers, which as well as Lord Bethell, included Matt Hancock and Sajid Javid, when taking part in these meetings, were very receptive, were very interested, and were very willing to listen and to sympathise. Yeah. However, we felt that it tended to stop there. We couldn't get these, the need that we felt for changes in policy. Even though we were sitting with ministers, it didn't happen, and that was very frustrating.
Right. I want to move on, perhaps finally, and ask you just about a sort of series of events later on in the pandemic, 6 months or so later. And for these purposes, perhaps we can go to page 13 of your witness statement, please, and it's paragraphs 50 to 51. And so we're now in January 2021, and then I'm going to move later in 2021 in a moment. But in summary, Ms. Sherwood, we'll all remember that it was around that time that the vaccine rollout started. And although it was clearly going to take a while, as you say in your statement, there started to be discussion about lifting restrictions once people had been properly vaccinated. And this was something that gave your group some concern, was it not? And explain, perhaps in a few sentences, and if you can try and keep the pace down, that would be appreciated. But please explain what the slightly different set of concerns you had about that prospect.
Yes. Okay, when the vaccine rollout was first announced, it was made clear that the vulnerable groups and the elderly would be vaccinated first. So those are the people who get severe acute COVID. So that made sense, but it didn't take into account the fact that long COVID can affect anybody. So we had already heard announcements by Boris Johnson that once we've vaccinated the vulnerable and the elderly, we'll be able to open up the country. And of course that concerned us greatly, because then the country would be completely opened up and all the younger people would be mixing in large numbers and would get COVID, and they may not go to hospital or end up dead, but they would be liable to get long COVID, and they weren't vaccinated. We can see that there seems to be a lesser incidence of long COVID in vaccinated adults, but these people weren't vaccinated. Of course, the children weren't vaccinated. There were no plans to vaccinate the children at all.
So, in summary, was your concern that the focus was very much on the acute COVID and the prospect that the vaccine programme would reduce the risk of of acute COVID, and on that principle allow more opening up.
Yes.
But that rather different analysis applied to long COVID.
Yes.
And that might risk infecting people, which would see a rise in long COVID.
Well, infecting a lot of people. I mean, as it happened, of course, this was the time when we just come out of Alpha, Delta was on its way, and there was the potential for large numbers of people to get infected because we would be without restrictions. And it was clear that the thought processes of government were just not considering long COVID as being anything, as being something that needed to be considered. Or certainly from our point of view, we didn't see any evidence that long COVID was a consideration.
Yeah. And the passage of your witness statement that we're looking at now, you refer to a letter there that you wrote about these concerns in January 2021, and then further down the page, you refer to the fact that you then wrote on very much the same theme in the last paragraph on the 6th of July.
Yes.
The January letter warning of this problem, and July saying it's still there.
It's happening, yes.
And we may all remember that I think it was the 20-something of July 2021 that was badged as sort of Freedom Day.
Yes.
And it was in advance of that you wrote this other letter,
Yes.
Mr. Javid, by this stage being the Health Secretary, essentially renewing your concerns.
Can I just
on this
add
basis.
that the other concern was not only was long COVID not considered by government, it wasn't being, there was no public messaging about long COVID at all. So not only were people at risk of developing long COVID, they didn't know about that risk. So they were unaware of the risk. Freedom Day just sends a message that we can all just go out and party and it's all over, which of course it wasn't. But what it doesn't express is that actually 5-10%, well, you know, it could be somewhere in between, of people won't get better after 2 weeks, and some of them will be very, very unwell for a long time. But that information wasn't out there, and so how could the public assess their risk?
And of course, those are the people who, some of them at any rate, were members of your group, and it was their experiences that you were very familiar with yourself.
Yes.
Can I just finally, Sherwood, just bring us forward? You describe the sort of campaigning actions that we've discussed already, and others, including on the point about messaging in your statement. But can you bring us up to date? What are your sort of campaigning objectives at the moment?
We felt at one point that we sort of lost the public health battle, that we weren't going to be able to influence the government to take precautions in order to encourage people to take more precautions to avoid getting COVID. At the moment, we're very concerned that there are there's no mandates for precautions even in hospitals, which is very, very difficult for people who don't want to catch COVID. If you go into any hospital now, most people who are working there are not wearing masks, and we've heard stories of that happening in wards with vulnerable patients. So people with long COVID, along with the clinically vulnerable, find it very difficult to go back into society, really, and to mix in the way that other people are. So as well as using our voice to inform people about long COVID, to inform people how to get help, we're still very interested in changing policy in any way that we can in order to give this condition a little bit more publicity, because there are many people in this country, unfortunately, who think long COVID is made up, that it doesn't exist, that there are people who've got it, they must all be public servants because they just don't want to work. I mean, there are some really nasty comments that we get on social media, and there are some, there's some beliefs that go around, and maybe it's worse on social media, which really stigmatise and denigrate the people who have this condition.
Yes. Well, Sherwood, I'm very grateful, and perhaps one can add that, of course, your involvement in this inquiry and the involvement of the other groups is part of that campaigning function,
yes.
And it's one for which I'm sure we're all very grateful. But as I said, we have your statement. We also have the statement of Ms Rogers and Simon McFarland, which we will adduce in full and which we have for our work. And I'm very grateful for you coming along and sharing your experiences with us this afternoon. Those are
Thank you very much
questions I
for
have
having
you.
me.
Thank you very much, Ms Sherwood. Very eloquent advocate.